Hey dental fans, welcome to Ask Dr. Rich. This is the show where I answer viewers' dental questions. In this episode, Kathy writes, "Hi Dr. Rich, I had my teeth pulled a few years ago and have full upper and lower dentures. My dentist keeps sending reminders to come in for a checkup, but I don't have any teeth. Do I still need to see the dentist? Thank you." Well, thank you so much, Kathy, for the question. And to answer you, yes, you definitely should go in to get your teeth, to get your mouth checked. Now, it's going to be a dental checkup, but it's not going to be the typical exam and dental cleaning that somebody with teeth would have. The first reason you should go is the most important probably is to have your mouth checked for any signs of oral cancer. Oral cancer is the 11th most common cancer to occur in the U.S. And it's very easy to check for at the dentist's office. It only takes a couple minutes, and the American Cancer Society recommends that anybody over the age of 40 get screened, get an oral cancer screening exam once a year. So for that reason, definitely go see your dentist. Because oral cancer, if it's caught early, the treatment's usually very simple. It just ends up needing to be biopsied, where they to see what it is, and if it's caught early, the biopsy is all that's needed. For the same reason why people go to see a dermatologist and get little funny-looking moles removed. The idea is to remove them before they become cancerous. Same thing in your mouth. The dentist will check inside your gum, inside your cheeks, check all the gums, check the roof of your mouth, check your tongue, sides of your tongue, underneath your tongue, floor of the mouth. They'll even tell you to stick your tongue out and say ah, make sure everything around your tonsils and the uvula, that's that little ball that hangs down in the back of your mouth, everything looks okay. Anything that's abnormal, they'll send you to an oral surgeon, or if it's further back, an ENT to have it taken, have it looked at. The second reason you should go is to get your, it's always good to go once a year and get your dentures cleaned and checked over by the dentist. Dentures, as you probably well know, pick up plaque and tartar buildup just as much as regular teeth do. And it can be very difficult to remove that tartar once it's attached firmly to the denture. Your dentist will be able to remove it. They got special instruments between the ultrasonic and various other dental drills, even worst case they need, where they can clean all the plaque and tartar off your tooth and then even polish it up to make it nice and smooth and shiny again afterwards. Also, while they're there, they'll take a look at your denture and to check the fit, check for any signs of wear. They'll check the teeth to make sure they're not worn down too much, as most denture teeth nowadays are made out of plastic. As you eat foods, the plastic will start to wear away, and eventually it'll get a little, they'll flatten down, and you might be okay chewing, you might not be. So your dentist can take a look and let you know if he recommends having those teeth replaced or maybe a new set of dentures made. Another reason to check the fit of the dentures is, as you know, over time your dentures will get looser. I made a whole video about that, explaining the reason why your dentures get looser over time. I'll leave a link to that down in the description and up here on the card. But basically, it's a slow process. After you get your dentures, your gums and jawbone continue to shrink, and your dentures will get looser. It's such a slow process, and most people don't notice it until, one day they'll like, they're moving around a little bit, let me use a little bit of adhesive. People start using some adhesive, and then over time they need to use more and more adhesive, or they'll even have to switch to thicker adhesives, such as the C-bond pads, to fill in that space. By getting your dentures checked regularly, you might be able to have a reline rather than have to rely on denture adhesive. The reline will fill in the undersides of the dentures and give you a tighter fit again, and hopefully at least decrease the amount of adhesive you need. Also, another thing that's important, especially for an upper denture, the the gums, where the part of the jaw where your teeth were is the horseshoe shape around the outside. So over time, that's the part that shrinks. The roof of the mouth part of the gum of your jaw doesn't shrink as much. So what'll happen is you'll end up with spaces underneath the teeth, but not where the not where the roof of the mouth is, and that'll cause the denture to rock side to side. And if you're chewing with it, you also increase your risk of cracking your denture in half. And that's a common place I see people come in with dentures with a crack right down the middle, and it's most likely due to that reason. So usually in those cases, we get the crack repaired. We do a reline to give them a little bit better support and better fit. And also make sure the bite hasn't worn funny, so that the bite's still proper and in the right orientation. So for those reasons, I'm going to recommend you go see your dentist at least once a year if you're over 40 years old, just to make sure everything's okay. So I hope that answered your question. If you have any further questions or anybody have any comments, please leave them below down in the comments section. And thank you all so much for watching, and I'll see you in the next video. Bye-bye.